Hi, I am Dr. Gobi. Today, under the family health expenditure, I will talk about polymedicine. It's a very important topic because people are living for a long time now. Life expectancy has increased, and many people are aging. With age, conditions like diabetes, high blood pressure, cholesterol, heart disease, restrictive lung disease, arthritis are on the increase along with their complications. So we have to give medications for these conditions, for these patients, on a continuous basis, because they are chronic conditions. So along with these medications, the side effects also, as I have said in my previous videos, happen. If we see for a patient, there will be conditions like diabetes, high blood pressure, and cholesterol come together most of the time. So these people need to be given medications. For example, if you see a patient gets about minimally about 4 medications to about maximally 8 to 9 medications. So before prescribing the medication, it is very important to see and educate the patient on lifestyle modification, like losing weight, doing mild to moderate exercise, stopping smoking, those things. Because lifestyle modification is the first thing we'll have to look into before giving medications. So lifestyle modification will actually reduce the amount of or number of medications to be taken. That is one thing to consider before starting medication. Secondly, when you write a lot of medications, the patients tend to skip buying the medication because they may not have enough funds to buy the medication. That we'll have to ask the patient whether the patient could afford to buy all this medication. And thirdly, when you give a lot of medications, patients tend to forget to take the medication, or they get confused. They may not take one medication, they may skip one medication, they may take low dosage or low dosage, and the frequencies they may forget. So a lot of issues come with this. Also with the complications, allergic reactions, drug eruptions, and so on. So patients tend to avoid taking medication because of the side effects. So before prescribing medications, actually we'll have to also tell the patient what medication is given for what reason, what disease, what illness. And also the patient have to be educated on the side effects and the frequency of medication and so on. Most of the doctors may not be able to or may not be doing these things. So it's very important, the patient and the doctor has to be careful with prescribing medication. Actually, doctor has to do a patient oriented management rather than a medication oriented management. So it's very important. Even if you see in Sri Lanka, one medication, there are so many products like brands available. So maybe one medication may be having 10 to 15 brands available. So the government also have to see whether to reduce the number of brands of one particular medication, like about 2 to 3 brands if it's available in the country. There won't be any confusion in prescribing or even the patients while they are taking medications. So polymedicine is a big issue. So this has to be reduced because polymedicine also comes with expenditure, a lot of expenditure. The patient with lot of side effects and illnesses. So the main thing is, I think in my opinion, the lifestyle modification, most of the time about 75% will help to reduce the number of medication. Actually, we will have to try to keep the medication at maximum 4 medications for a patient and minimum 2 medications. So I hope this video will help you all. I will be talking about specific conditions, specific medications in my forthcoming videos. Thank you.